we'll see you later.
Saturday morning, 13 minutes past 9, almost exactly this time, approximately this time every Saturday. You're probably aware by now. We catch up with two experts and friends of the programme. Professor Linda Bauld, who's Professor of Public Health from Edinburgh this morning. Linda, very good morning to you. And Dr. Chris Smith, virologist, of course, speaking to us from Cambridge.
Morning.
Good morning to both of you this morning.
Morning.
Can I start, Linda, with a kind of, we've got a few questions that are coming to us. Can I start with a first thought, which is one people well aware is one of the crucial issues. We look at infection rates and we look at hospitalisation. And this, we're told, is one of, I know there are a number of key factors around what happens next. Can you concentrate just for a moment on what picture there is emerging in relation to the Delta variant and hospitalisation?
Certainly, Charlie. So we're beginning to be able to compare the proportion of people who are in hospital now with COVID-19, bearing in mind that the Delta variant is the dominant variant, so the vast majority of them will have picked it up with that variant, compared to what was happening before we had the vaccine rollout. And roughly speaking, if you look back to the beginning of the year, for example, early 2021, you had about a hospitalization rate relation to infection of about 15%, 13 to 15% of people infected, sadly, would need support and care in hospital. We now know it's reduced to about 4 to 5% of those who have picked up through a positive test. So you can see that that relationship has definitely weakened, which is really good news. But we still have a significant number of cases. You know, we had over 10,000 cases yesterday, and it's likely that even if 4 to 5% of those people end up in hospital, say 10 days from now, that's more than we would wish. But the link is weakened even in the face of this variant, and that's good news.
Chris, morning to you. We have had quite a few messages in, actually, and questions. Sally is asking, how long will vaccine protection last before another is needed? And I've also had an email from a gentleman, Tony, who says, I've had the virus and I've got a stimulated immune system. I have antibodies. I don't want to have the vaccination, no matter how small the risk is of an adverse response. I've no need to take any further risk. I'm certainly no more of a threat to others than those who've had a vaccination. Why should I be forced to take the vaccination?
What we've learned over the course of this pandemic, and we had some insights about the coronaviruses as a family of infections, is that the immunity that we make to them isn't long-lived, at least not for everybody. Those people who were illest tend to have the most robust immune response, but people who have more trivial illness, perhaps including Tony, tend to produce less of an intense response. And over time, that response that we can detect drops away, and a person would eventually not have very high levels of antibody. Now, whether that translates into a person who's fully susceptible to severe coronavirus infection again, we don't know. It was a rate of reinfection. So really, there are two things to draw from this. One is that with time, immunity does wane to coronaviruses, which argues we probably do need to give people some kind of strategy for boosting their immune system. And with variants that crop up from time to time, like the Indian or Delta variant we're dealing with here in the UK, that does require higher levels of immunity to remain protected. And so for both of those reasons, a good strategy would appear, at least in the short term, to have up our sleeves a boosting strategy. So come the autumn, we would perhaps prioritise those most severely at-risk individuals to make sure their immune systems are as topped up as they can be, which gives them the best prospect of not becoming unwell.
Linda, and we've got a question here which is in relation to long COVID. A study has shown that the vaccine reduces the risks of long COVID. So can you just clarify something for me? If you've contracted coronavirus and then had the vaccines, are the vaccines going to have any impact on whether you might suffer long COVID?
Sure. So there's some interesting results coming out on this. The first thing I would say about long COVID is there's a lot we don't know, and that's why there's big research programs 12 weeks after a positive test or if infection is confirmed. In terms of what we know about vaccines and long COVID, the study you're referring to, Charlie, was conducted by colleagues at King's College, around 30% less likely to develop long COVID or to report those symptoms, on top of the fact that, of course, having the vaccines prevents you from having symptomatic COVID full stop, as we know from results. So it looks like it will have an impact for those people who, unfortunately, which is a small proportion, do still develop COVID after they've had vaccines, less likely to have long COVID. The other final point I would make on that, there's also some evidence from studies that people who have been vaccinated and already have long COVID from a previous infection, that their symptoms are alleviated by having the vaccine, which is good news. So again, the public health message is, even if you've had COVID in the past or you're worried about getting it in the future, the best thing everybody can do is to take up the vaccines.
With that in mind, Linda, I wonder if you could answer Jack's question. He says he's struggling to book a vaccine, and of course anyone over the age of 18 can now access having a vaccination. And he says the website says he's not eligible. His GP says wait for an invitation from the NHS. Is this the correct advice?
Okay, well, we don't know where Jack lives in the UK, but just briefly, let's assume Jack is in England. That invitation or allowing 18 and above, the youngest adults, to book is very recent. So if you go onto the nhs.uk, to the NHS Inform website, the gov.wales website gives that younger age group information as well. They've already all been invited. And for Northern Ireland, again, you can go onto the HSC website, Northern Ireland, and book your appointment there. Their eligibility is a bit different, but do check that. So hopefully Jack can get his appointment as soon as possible. And as I say, there's help on these websites if there's any questions.
Now, of course, Chris, the devolved nations all at slightly different places in relation to the vaccine rollout. But in England, for example, all adults, all over 18s now, are being sent invitations. I think yesterday it was 1.5 million texts were being sent out. This question from Nigella.
We vaccinate people, obviously, to do two things. Number one, to protect them from catching the infection. Number two, they can't give it to anybody else if they haven't got it. So we achieve level at the protection of the individual. We achieve protection at the level of society. Now, one of our aims is to try to suppress the spread of the virus through the population to the greatest extent we can, and therefore minimise the chances of people who are really vulnerable and could die from it catching it, but also minimise the chance that variants arise that could bypass the protection conferred by the vaccine. So at what threshold do we have to vaccinate people? Well, to reach that magic number of what we're dubbing herd immunity or population immunity, estimates vary. But we think somewhere between 75 and 90% of the population would need to be vaccinated in order to suppress the spread of the virus through the population in that way. The more infectious a virus or any entity is, the more people you have to vaccinate to achieve that level of protection by the 12 to 16-year age group. That's part of the equation. The other part of the equation is that if we do go and protect those people, that this probably will safeguard their education a bit better. It probably will provide less risk to other family members that if they caught the infection, they could give it to. We also know at the moment that younger people are accounting for some of the most significant outbreaks for two reasons. One, they haven't been vaccinated yet. Number two, that they're actually the most networked people in society. They're more likely to have contact with other people. They're more likely to be in jobs or at school. They're more likely to be on public transport. They're more likely to be going to parties and so on. All factors that increase the risk of transmission. And so there is currently a conduit through society offered by those unvaccinated groups that allows the virus to spread. And one way to suppress the infection and close that corridor is to offer vaccination to those individuals. And we can take reassurance from other countries that are doing this, that the vaccines appear to be safe and appear to be working well in those groups.
So much less. Why would we worry about a wave?
There's a couple of reasons why I think the Chief Medical Officer has said that. The first one is that, as Chris has been touching on, we don't quite know how long in protection from the vaccines will last. And let's bear in mind that the original trial participants would have had probably their double dose by the earliest September of last year. So we really only got 9 months or so of follow-up for those people. So we just don't know about length of protection. So if you have more infections later in the year and vaccine protection is waning, you've still got some people unvaccinated, that's a cause for concern. It's a very small part of it. The virus can spread at any time of year, but the winter is going to be more challenging. So we need to prepare ourselves for that. And most importantly, of course, our clinical colleagues who've been working for many months and are really tired, they're going to need support this winter to deal with that. And of course, all the other things the NHS deals with in the winter.
Linda, a question for you from one of our viewers. Did you watch the football last night?
I saw some of it. I was absolutely delighted. I don't know whether you can spot the
Can
slight
see
thing in
it.
the background. Yeah. So my son, my 18-year-old son, was watching it at a friend's house and very kindly loaned me. So I'm just so pleased for Scotland. I'm not a football expert, but you know, it's the first time. Last time they were in this similar tournament, I was 28. So absolutely thrilled, and fingers crossed for the next match for both England and for Scotland, of course, which is on Tuesday.
Got to ask you, Chris, as well.
Well, I'm pleased to say that my predictions about coronavirus are much more accurate than my predictions about football. Because on national radio yesterday, I made the pronouncement that I anticipated a 2-1 defeat against Scotland by England, with the first goal cropping up in the 50th minute.
Well,
I was wrong.
Yeah.
Yeah.
What do they say? Stick to what you know.
Exactly.
Is that what they say?
I think they do.
Yep.
I think they do. Chris, Linda, always lovely to talk to you. Thanks very
Pleasure.
much for your time in this our regular
care.
panel of experts answering your questions. Keep them coming in.
Saturday morning, 9:27 the time.